Hello everybody, I'm at the ESC meeting 2017 in Barcelona, and I'm very happy to share with you a very exciting session regarding device-based therapy in the field of hypertension, and especially focusing on a new target, which is the baroreceptors. This session was very interesting because covering three major aspects in the field. First, the relevance of the Baroreflex as a target for the management of resistant hypertension and heart failure, showing that this reflex is in fact involved in the pathophysiology of resistant hypertension and heart failure, and that by playing with this reflex you are able to modulate in a very nice way the autonomic nervous system by both inducing restoration of the autonomic imbalance stated in both hypertensive and heart failure patients. The second part of the symposium was a kind of a wrap-up about the studies in the field of hypertension, showing that the first generation, but especially the second generation device, which is an easy-to-insert device, where within an hour of hospitalization you can offer this therapy to a resistant hypertensive patient. Well, this device was able to reduce blood pressure in a significant way, and Peter Deleu showed also that when you follow up this patient for 1 to even 6 years, you still have a significant decrease in both systolic and diastolic blood pressure with no safety issue. And finally, the symposium ended up with another perspective, which is the use of the baroreflex activation therapy in the field of heart failure. I think that the major findings are presented in a paper published in the JACC, showing that in heart failure patient with reduced ejection fraction, this device is able not only to reduce hospitalization, but also to improve quality of life as assessed by the 6-minute walking test. So I think to wrap up, a very relevant and interesting target, the baroreceptors in the field of hypertension and heart failure, a new device able to change the natural history of our patient, and a lot of exciting new studies going on in the field with these devices.